Let me be real with you for a moment. If you've been lying awake at night, feeling like something's crawling under your skin or your legs just won't stay still, this isn't just getting older. It could be something much more serious. It's called Restless Legs Syndrome, or RLS. And it's not just annoying, it's a real condition that affects your nervous system. Left untreated, it can slowly wreck your sleep, your mood, and even your overall health. I remember one patient in her late 60s who came in looking completely worn out. She told me she hadn't slept a full night in years. "Doc," she said, "every time I try to rest, my legs start tingling, almost like static electricity. I have to keep moving just to feel normal. It's driving me crazy." And honestly, she wasn't exaggerating one bit. RLS affects somewhere between 4 and 14% of people, depending on where you look and how the studies are done. Women are about twice as likely to get it as men, and it gets more common as we get older. That's not just frustrating, it's serious, especially when it steals your sleep night after night. What makes this worse is that most people with RLS go years without knowing what's wrong. They assume it's all in their head, or a circulation problem, or just something to accept as they age. But it's none of those things. It's actually a brain-based condition linked to low iron in certain parts of the brain that control movement and sensation. Doctors have seen this clearly through brain scans, which show that people with RLS often have less iron where it matters most, in areas that help control dopamine, the chemical messenger that helps your muscles work right. Here's something that worries me: even many doctors don't fully understand this condition. Some prescribe medicines that boost dopamine to ease symptoms at first. But over time, those drugs can actually make things worse, causing the symptoms to start earlier in the day, spread to more parts of the body, and become harder to control. This is called augmentation, and it means that treating RLS the wrong way can backfire badly. So let me say this loud and clear: RLS isn't just a little nuisance you should brush off or try to live with. It's a real neurological disorder that can get worse over time and affect not just your sleep but your mood, heart health, and even brain function. Today, I want to help you understand exactly what RLS is, what's happening inside your brain, and how to spot the signs before it takes over your nights and your life. Don't worry, you don't need any medical degree to get it. I'll explain everything simply and kindly, just like I would to my own mom. Ready? Let's get started. So, what exactly is going on inside your body when you have restless leg syndrome? Imagine your legs are sending you signals like a radio picking up static, those uncomfortable tingles, crawly feelings, or the need to move. But instead of calming down when you rest, these signals get louder, especially when you're trying to relax or fall asleep. Scientists still don't fully understand why this happens, but research has uncovered some important clues. One of the biggest factors is related to iron, not just the iron in your blood, but iron inside your brain. Iron is crucial because it helps brain cells communicate, especially those that produce dopamine. Dopamine acts like a traffic controller for your muscles, telling them when to move and when to stay still. When there's not enough iron in those parts of your brain, dopamine can't do its job properly. That's when those overwhelming urges to move your legs kick in, like your brain is trying to fix the problem but ends up sending mixed signals. And that's why people with RLS often feel relief only when they move their legs. Here's something important: having restless leg syndrome doesn't necessarily mean you're anemic or low on iron in your whole body. It's a very specific iron shortage in the brain, which is why a simple blood test might not catch it. Brain scans, like MRIs, have shown this iron deficiency in the areas that control movement and sensation. Doctors and experts from respected institutions like Harvard have pointed this out in their patient guides. The urge to move your legs usually hits in the evening or at night, which explains why so many people with RLS struggle to get a good night's sleep. Imagine trying to fall asleep, but your legs won't stop twitching or moving. Over time, this can lead to serious sleep problems, leaving you tired during the day and affecting your mood and focus. Because of this ongoing sleep disruption, many people with RLS also face issues like anxiety and depression. It becomes a vicious cycle. The symptoms interfere with sleep, and the poor sleep makes the symptoms worse. This connection is well recognized by leading health organizations like the Mayo Clinic. Now, I want to share something from my experience. I've seen patients who suffered for years, thinking it was just part of getting older or something they had to live with. Some were told to just deal with it or ignore it. But trust me, that kind of ongoing frustration and exhaustion can really drain your joy and make everyday life harder. The good news? Once you recognize these signs and understand what's happening, relief is possible. There are treatments and lifestyle changes that can help, and I'll walk you through those in upcoming videos. For now, just remember, restless leg syndrome is real, it's common, and it's something you don't have to suffer through alone. So, let's dig a little deeper into what's really going on inside your body when restless leg syndrome shows up. Imagine your brain as a super busy control center, constantly sending signals to your muscles to tell them when to move and when to relax. For people with RLS, this control system starts sending mixed messages. It's like the volume on your radio is turned way up, but instead of music, you're getting an uncomfortable static that just won't quit. One of the biggest clues scientists have found is that iron plays a huge role here, but not just the iron you think about when you hear about anemia. It's iron deep inside your brain, especially in areas that manage movement and sensations. Iron is like a helper, making sure your brain cells can talk to each other smoothly. Without enough iron, these brain cells struggle to work properly, especially those that make dopamine, a key chemical messenger. Dopamine helps control your muscles, telling them when to relax or move. When dopamine signals get scrambled, you start feeling that uncontrollable urge to move your legs, especially at night. That's why many people with RLS feel that relief only comes when they get up and start walking or stretching their legs. Now, here's something really important that often surprises people. Restless leg syndrome isn't always linked to low iron in the blood. You might have perfectly normal blood iron levels, but still have a shortage inside your brain. This kind of iron deficiency is very specific, and it's one of the reasons why RLS can be so tricky to diagnose. Brain imaging studies have shown this iron shortage clearly. Experts at places like Harvard and Mayo Clinic have studied this and agree that the low iron in the brain impacts dopamine production, which then causes the uncomfortable symptoms. You might be wondering, why does this mostly happen when I'm resting or trying to sleep? It's because your brain's control over movement slows down when you relax, so the mixed signals get more noticeable. It's almost like your legs rebel when you're still. And all of this has a huge impact on your sleep. If you're constantly needing to move your legs just to get comfortable, falling asleep becomes a battle. Over time, this leads to chronic sleep loss, which affects everything: your energy, your mood, your ability to focus during the day. Studies show that people with RLS are more likely to suffer from anxiety and depression, partly because of the ongoing sleep disruption. From what I've seen in my practice, this condition can feel really isolating. People often feel like no one understands what they're going through. They might even feel embarrassed or like it's just in their head, but it's very real, and it deserves attention and care. The next step, in future videos, will be to talk about how we can manage RLS safely and effectively, because there are options that don't involve risky medications or side effects. For now, just remember this: restless leg syndrome is a real, brain-based condition linked to iron and dopamine that makes it hard to rest, but knowing what it is the first step to getting your nights back. So, now that you know what restless leg syndrome really is, this misunderstood, brain-based condition that can steal your sleep and steal your peace, you're already one step ahead. Understanding it is the foundation for getting better, and you don't have to suffer in silence or think it's just part of getting older. In the next video, we'll talk about what you can actually do to ease these symptoms safely and naturally, without risking those medications that sometimes make things worse. I'll share practical tips and treatments that can help you reclaim restful nights and better days. If you found this helpful, go ahead and give it a thumbs up. If not, just type 0 in the comments, but if it did help, type 1 and let me know. And don't forget to subscribe for more life-saving health tips that really make a difference. Thanks for spending this time with me today. Take care of yourself, your body and your brain deserve it.